So one of the things that I have parents ask a lot is, what do you do when your child is in the middle of a meltdown? What do you do when the stress becomes so overwhelming that it turns into a panic attack and then everybody freezes and you really don't know what to do in that moment? So depending on the age of the child, there are certain things that you might be able to do to kind of help that stop in that moment, really depending on if the child's able to follow directions, if the child's a teenager, if it's an adult. So you kind of have to look at, where are you at? What is your ability to really think rationally in that moment and your ability to follow directions? And the biggest thing I want you to think about is that when we are having a meltdown, whether it's a child or an adult, what is your breathing pattern like? It's probably not very smooth and rhythmical. Most of the time it's, we're getting really worked up. And so you're not really getting good blood flow, good oxygen to your brain at that particular moment. And I know that you really can't tell a child to take a deep breath in that moment, because that's not going to work. It's just going to cause more agitation, and really they're not able to follow directions anyway, because when you're in that moment of meltdown, the first thing that's going to go most of the time is language, their ability to follow directions, as well as their ability to speak and tell you what it is that's going on. And so that's where that co-regulation piece can really play a role and can really be helpful, depending on the age of the child. Sometimes just being there and being present and you having a grounded breathing rhythm and a solid heart rate will help them. If you're holding on to them and giving a big hug, it's going to help to bring their alert state down a little bit, because their breathing should mimic your breathing and their heart rate should follow suit with what your heart rate is. Another thing that you can do is just kind of like deep patting on different parts of them, on their chest, on their back, on their arm, whatever it is that you can touch, that they'll let you touch, because what we want to do is just kind of help with stimulating their sensory system, their proprioceptive system, their deep muscles. We want to try to get that deep breath. They're going to do that on their own. It's not something that you're telling them to do. Them taking that deep breath really is helping to reset their nervous system and bring them down from a 10, just maybe down to an 8, but it's enough to bring them down where it becomes a little bit more manageable. It might be even that you're doing some head squeezes, because for some of the younger kids, they really respond pretty good to that. Hand massages or even feet massages, if they will let you, because I know that if you're in the middle of a meltdown and kicking and screaming, that might not always work. But what you're really looking for is their ability to get to a point where they're able to take that deep breath, because again, that means that they're starting to slow down in their alert state and where they're at on that autonomic ladder, or where they're at with their alert state and their agitation, or however it is that you kind of are able to relate to it. But they're coming down from a point of overwhelm to a little bit more manageable with their behaviors and their emotions. If it's a child or an adult that's able to follow directions, even us as parents, this is really helpful, is doing a simple tapping technique, and that helps sometimes to bring your alert state down, because what we're trying to do is to just stop the pattern and to help with resetting it. For younger kids, I might not be able to always get them to be able to follow a sequence, and so I might just start by just having them just tap here. You could go back and forth, okay, just kind of coming here, even just tapping here or here, just picking a point and just getting a verbal sequence that we're just trying to tell the body what it is that we want it to be. So maybe it's, I am calm, I am grounded, I am relaxing, it's okay. Whatever you can really get them to do in that moment is what we want them to do. For an adult, the sequence is, you're going to kind of start with this karate chop here. You can start here, okay? And then you're tapping in the middle of the brow, and then the outside of the eye, and then underneath your eye, and then here, your collarbone, and then underneath in your armpit area, and then on the top of your head. And you're going to combine that with a verbal tapping sequence. And so what that might look like is, even though I have this anxiety, it's okay, because I'm calming down, I'm calming down, I'm calming down, I'm calming down, I'm calming down. Even though I have this anxiety, it's okay because I'm calming down. You can really figure out whatever it is that you're feeling. That's what the emotion that we want to acknowledge. And then we also want to tell the body what it is that we are doing or that we want it to do. I think it's important to really combine these verbal sequences with it, because we want to always acknowledge the emotion of what it is that your body's experiencing, but also tell the body what it is that you want it to be. You can kind of pair it together, but we always want to acknowledge that positive, what your body's feeling at that particular time, because that's the truth of what you're feeling in that moment. If you want some examples of some tapping sequences, I have a bunch that are written out for kids and for adults. So just drop me a line and I'll be more than happy to send it to you. Thanks for watching.